Week 1 of Health Informatics by Group 31.
So what is health informatics? According to the article by Julian Sweeney, health informatics is the integration of healthcare sciences, computer science, information science, and cognitive science to assist in the management of healthcare information. It also connects people, technology, and data to better improve healthcare outcomes and safety by supporting operational, innovational, and technological advancements. Technology has helped increase the availability of information, improve the quality of patient care by reducing tests, and improve clinical productivity. So why do we hear the term health informatics more than we hear medical informatics? We hear the term health informatics more often than medical informatics nowadays because there are many different information handling roles of the non-medical healthcare professions. Health informatics better defines the integration of the information agenda for health services. Medical informatics is a subdiscipline of health informatics that directly impacts the patient. It focuses on the information technology that enables the effective collection of data using technology tools to create medical knowledge and foster better patient medical care.
With technology creating an impact in the medical field, it provides different career opportunities for anyone who is interested in IT and health. These are some of the common careers people go into when selecting a path for health informatics. These descriptions are from USF Health Online, so I'll be breaking down some of them. A chief medical informatics officer duties may vary from one organization to the next, but on a regular basis, the average CMIO may evaluate an organization's IT systems, design and apply EMR, EHR software and applications, convert and analyze medical and health data, leverage medical and health data to improve services and daily operations, and more. So just like chief medical informatics officers, nurse informatics specialists' role may also depend on the location since the role is still relatively new. In general, however, the American Nurses Association defines the position as overseeing the integration of data, information, and knowledge to support decision making by patients and their healthcare providers. For healthcare IT project managers, IT project managers typically oversee large complicated projects that involve technology. Project managers typically aim to produce quality results with maximum efficiency, on time, and on budget. For health informatics consultants, they oversee clinical application systems and databases that healthcare organizations and facilities that utilizes patient records. The job can also include duties related to all aspects of the system from implementation and modification to staff training and solving any problems that might arise from the software itself. And what I learned from this is all of the different careers you can go into with the field of health informatics. Although most of these touch on similar descriptions and roles, they still somehow have a different way of handling IT within those specific positions. I also learned how many different locations are generally different in terms of the role of these careers.
Health informatics is extremely important to the healthcare industry because it bridges the gap between the doctor and the patient using technologies such as smartphone applications, making contact between the two much more accessible. An app titled Remote Monitoring in Rheumatoid Arthritis, or REMORA for short, made exclusive to rheumatoid arthritis patients involved in the study, is an example of the increased accessibility between patient and doctor. Rheumatoid arthritis is an autoimmune condition that has several factors playing into what is called flares, periods in which the joint pain caused by the disease is intensified, requiring as much information as possible to determine how these flares pop up in the patient. Daily monitoring of patient symptoms without the need to personally see a doctor helps minimize recall bias, as well as increase the amount of information doctors and researchers can use to further assist the patient. As we can see from the image presented, different questions are presented to the patient, ranging from daily questions to some given monthly. Recall bias is minimized here because the questions are presented as the event happens or is just completed, rather than having the patient answer questions that had happened weeks prior. The doctor can then use that information to judge factors on rheumatoid arthritis flares and give further treatment to the patient with that in mind.
How is the remote monitoring in rheumatoid arthritis effective for clinicians? From the data gathered through the daily monitoring system via smartphones, clinicians can have a more personal discussion with the patient to come up with an effective treatment plan. Clinicians are more effective when consulting patients if they have easily accessible data of a patient's daily medical conditions. The data monitoring allows more evidence-based information on the patient's symptoms instead of what a patient can recall during a short consultation. I learned from the lecture and articles that the way in which technology and smartphone apps are used dominantly nowadays have been greatly integrated into the medical and healthcare fields to ultimately help improve the quality care of patients through the easy accessibility of health-related data and medical records by doctors and patients.
The increased accessibility not only impacts the hospital and clinical staff, but the patient as well. Health informatics allows for integration of the patient's everyday life to be connected with a doctor, especially that of social media. An AOA survey in 2018 showed that a majority of millennials and a smaller amount of adults would like to use social media as a way to contact their primary care physician. Imagine being able to tweet at your doctor for advice on your symptoms. The discrepancy between the millennials and adults in utilizing ways to contact the doctor needs to be addressed, but health informatics can cater to both age groups. For example, ways to increase information given to the patient during outpatient visits, the preferred method by adults, can come as a result of enhanced patient charting via informatics. There are necessities to the increase in accessibility, however. With HIPAA standards to uphold, strict regulations in terms of the technology integrated with the hospitals need to be enforced. This means a lot more staffing required to manage these informatics and monitor against any unwanted access of patient records and other medical information.